morning. Greta Ward.
Leonard Tapia.
Tim Hale.
Lamont Lopez. George Quintana.
Jeremy Avarella.
Troy Jones.
Lori Montgomery, New Mexico State Veterans Home.
Jamie Davies.
John Elvis.
Charles Rio.
Stephen Dorman.
Gail Nash. Lynn Gallagher.
And Brad McGrath. So we do have a quorum for today's meeting. I appreciate it. Kathy, I think the only absentees you're putting down are two.
Yes, Secretary Rinaldi and Daphne Root Hopkins and Gabrielle Sanchez is running late.
All right, she'll be here in a little while. And thank you. And also, so we have a quorum, and the first item on the agenda is the approval of the agenda. And the agenda for today is our standard agenda. We'll also go into a closed executive session later in the meeting. But if you'd all look at the agenda for a moment, and I'll ask for a motion to approve the agenda. So moved. Second?
Second.
All in favor? Aye. No opposed. Motion's approved unanimously. And we also, we look at the minutes from the previous meetings. Now, it seems longer. I don't know why. It seems like October 17th was a long time ago. But we have in here, Kathy, I think from page 1 to page 21
Yes.
would be from prior meetings, including October 17th meeting, which was held, which Troy did a great job. We had up at the Behavioral Health Institute in Las Vegas. It just seems like a long time ago. But appreciate that.
It was last year.
Yeah, well, it's true. It was last year. We also have the administrative reports from October 17th, which I think are all, nothing there to really talk about too much. We also have in that the, let's see, on page, that's all your administrative reports. And we have the credentialing report from October, which was approved in October. And then we have the program area 6 financials, I think on page 23. So I think it's up to page 23, Kathy, right?
Yes.
That would be the last time. And so again, I'll ask for a motion to approve the minutes, all the combined minutes, and the credentialing report, financial report from October 17th. Motion to approve that. Second?
Second.
All in favor?
Aye.
Opposed?
I'm sorry, Brad, who made the motion? Lynn. Thank you.
Okay, so that motion is approved unanimously. And that takes us up to our new business reports. And as always, we start with our Cabinet Secretary report from Secretary Ward.
Well, first of all, I want to welcome our new Chief Medical Officer, Dr. Stephen Dorman. This is his first Facility Governing Board meeting. What was your official start date?
November the 21st.
November 21st. So he has been very busy, and I think all of you have had an opportunity to interact with him before this meeting. But we're delighted to have Dr. Dorman join our group, and Marty's already added a tremendous amount to the work that we're doing. So welcome, and thank you for joining us. And I want to thank everybody here for the work that you've done for getting us ready for the legislative session for the hearings. We're partially through the hearings. We have Senate Finance Committee next Wednesday, 27th.
It may have been changed, not officially up to the 27th, but I haven't seen it officially
Okay.
changed.
But it's coming up. And I really appreciate your presence, even though we don't always have to call on each of you during the hearings. It makes me feel better to know you're back there. So thank you very much for all the work that you and your fiscal folks are doing to prepping us. The session starts next Tuesday, and it's a 30-day session. So we have a number of DOH legislative initiatives that we'll talk about at a later time. Not nearly as many as last year, of course, because it's a 30-day session. But I want to thank all of you for the work in advance for doing the FERS and the analysis that's required. So thank you very much.
And I only had a couple of things to add to. facilities meeting, and thanks to George and Katrina, we're going to do the facilities meeting here tomorrow morning between 9 and 2. We're going to work through lunch. So I think we have a lot of stuff on the agenda tomorrow, and Dr. Dorn and Gail got some good ideas we want to talk about tomorrow, good things we need to do and or want to do. And so I appreciate everybody coming back for that. And I'm going to meet today at 1 o'clock with the Turquoise management team, and I think we have a room for Greta today for her meeting that you're going to provide. And I appreciate that too. We'll have food tomorrow, so you're going to provide pizza tomorrow. Leftover pizza from today.
One piece every day, so we have enough for tomorrow.
Okay. All right. And I appreciate, again, I know the administrators here, I know that, a lot of you have to travel long distances, and with the Senate Finance Committee, when we find out the exact date of it, we'll be requesting your presence there again. I know that'll be real important. It's different group, we just have to get a better sense of what the issues or questions will be there. It'll either be the 22nd or more likely the 27th of January now. That will take place. So I appreciate everybody coming back up for that. Just, it's a busy time. Hopefully we don't get any snowstorms. I'm grateful for that. Everybody driving around. The weather would stay good. I think that's the only things. I know when we get in closed session today, we'll have some topics we'll talk about that we need to talk about. And do you have any things you'd like to mention?
Nothing really to report other than it's really a blessing to work with both Retta and Brad and all of you. I think that we have a really tight group of people, and I'm honored to work, and we're gearing up for the session, so everybody get a lot of sleep.
And Troy, I think we'll start with you today. The next item we're going to do will be the facility administrator reports, which I think is page 24. And I guess, I know you're probably going to comment on your construction project.
I got a few areas to talk about. We'll go through the census first. In our adult psychiatric division, we had 196 admissions, 192 discharges, and we're averaging about 72 through that quarter. On our adolescent unit, we had 2 admissions, 1 discharge, and our average daily census has been 11. Our forensic division, you can see we had 33 admissions, 40 discharges, and daily census is 56. We're hovering still around 36 on our 1.5s. Over the holiday season, you see a decrease in admissions to forensics because the courts closed down and a lot less activity going on. Our outpatient community-based services program had 155 admissions, and our current census is sitting right around a little over 1,300. Our nursing home, we had 9 admissions and 10 discharges with an average daily census of 149. The New Meadows, which is phase 1 has been wonderful, and now phase 2 is expected to be completed. We're thinking the end of February, and we're expecting move-in sometime in mid-March, if all the FF&E and everything get in place like it should, to be moving in mid-March. I've already talked to Kenny just to kind of get him ready for Aberdeen.
Yeah, I don't have to interrupt you, but expand a little bit for Secretary Ward. I know when we opened up the first one, that was a big deal. Everybody in the world was there. It was a governor type of thing. But how do we handle opening up the second one in terms of the ribbon? Do we do a ribbon cutting or?
That would probably be up to the Secretary and yourself, how you would like to do that. We want to move in as soon as possible, so if we're going to do that, it'd be really good to plan. I won't have a formal move-in date until closer to completion and making sure that the FF&E is actually going to be on time. But they're looking at
that help pay for that, like legislative representatives, and everybody wants to,
I think it'd be good to make some kind of a celebration out of that and recognize the individuals that were responsible for supporting it and getting the monies
a lot of money
allocated. Absolutely, and then it would even help, of course, for this session going for phase.
There would be a good thing to do.
Yes.
Maybe with Kenny, we need to have a talk. We need to celebrate.
I've emailed him back and forth a few times and keeping him posted on when we're looking at doing it. So I think he's gearing up to get that done. They want us out of there as soon as possible because April 1, they want to start demolishing the old meadows, given that we have the $2.1 million that was allocated last session. Everything's rolling in place for that to be demolished at the beginning of April.
Okay, that's exciting. And I know, could you also expand for a moment? I know with Tress, you know, who's our legislative liaison, you know, with the session starting, and with Mike Brown and Linda Kehoe, we had talked before about this 10-year bond thing to help finish the, you know, the $23.5 million I think we need for the last phase. And then he said he didn't think we needed to do it, but now I'm not sure we need to do it. But that's something we'll want to talk about in more detail too.
They're looking at, it's the cigarette tax revenues that they're looking at to make sure that we can try to obtain about $3 million from that, because the LLC is coming in saying if we can stay at the $20 million mark, it would be, it's almost like $19.99 versus $22, $23. It's more palatable, it's easier to swallow. So it's looking favorable, and we actually have a meeting this afternoon at 1:30 with the Capital Group to go over that.
Good. Where's that meeting up at?
In Santa Fe.
Okay, I'll make sure you get to it.
Thanks. Okay.
Now, will you keep me updated on that? Do you think we'll have to do something in the legislative session as a result of your discussions?
I think given that the LSC DFA is involved in these meetings, I think that's all going to be worked out by the time we're looking at the final number.
All right, great. So you're optimistic?
I'm cautiously optimistic. I said, you know, that's the most important thing for the Department of Health, and I speak for the government. No, I did not. I said that, you know, of course, that's one of our priorities. We'd like to see the project completed. We're going to have 72 more beds now in February, moving them in March, and then phase 3 is an additional 72, so I can then close down, move everyone out of the old buildings and all into new rooms. A lot of community members are already calling for their loved ones, waiting on the new building to open up to become a resident at the facility. So it's actually pretty exciting for the community. A lot of people coming in wanting tours of phase 2.
Right.
It's not complete.
Well, that's why I think we need to have a celebration.
I agree.
It's a very big deal.
It's huge.
It's huge. Great, thank you.
We're finally seeing our dream come true on the cameras. We've been pushing for cameras inside our adult psychiatric division and patient care areas for some time in the buildings. And we have our PO being processed, so I'm hoping we're going to have by mid-February we should be seeing cameras in our adult psych division, at least on the Tasuki units, acute units, and then moving into the extended care units, hopefully in March or April.
Yeah, that is a big deal.
And just from a personnel standpoint, we had 61 positions that we filled. 44 of those were new employees. We had 10 lucky individuals. They retired during that quarter. Unfortunate for us, we lost a pharmacy director and a director of our security and emergency preparedness. Two
They're both great people.
wonderful individuals. A huge loss, but they did a good job of training, and so the individuals that are in those departments are stepping up to the plate until we get the positions filled. We've already pulled our list down on the director of pharmacy, and the guy that's interim right now is on the list, and he's been our director before. He's wonderful, so we got good candidates.
Troy, what was the breakout of those new employees? Were they primarily caregivers?
The majority of those were, yes, sir. Yes.
Nurses?
Not as many nurses. Psych techs, we had some psych techs that came in, dietary, and some housekeepers, but the nurses, very few. In fact, that's our largest vacancy now is in our nursing department, and that's why our nursing temp contract is being utilized as it is. We have a lot of positions posted for nurses, given in the rural area. When they come down, nobody on the list. I've had actually housekeepers and dietary staff on the list, but they're not qualified to have an RN degree, so I'm not sure how
I
they
mean, you know, we're hoping Director Mosher is addressing that executive recommendation as well.
Right. Good news, chief of psychiatry position was filled. Hallelujah. We have a start date. The individual works for UNM, so they have to give a 4-month notice. How do we get that built into the Department of Health? I'd like to have that somehow worked out. So he's given a 4-month notice, and we'll be starting. Actually, it's going to be May the 12th is his first start date.
What's his name, Troy?
Dr. Dunn. We were actually also fortunate to get a part-time FTE primary care doc, Dr. Kern, going to start in February, and we have another interested neurologist that's in our local community, that's looking at getting out of private practice and going into our facility. She's very interested, so we're hoping that's going to happen around the same time. Our long-term care division completed a restraint-free certification application, and I know that we had a visit from the Ombudsman Office and their staff coming through and evaluating our program, so we're hopeful that we will be considered for that. I'm not sure if anyone else has that certification. It sounds like it's a rare thing to come across. Given the population we deal with, I think it really speaks well to our staff's interventions and trying to work on not using restraints and finding alternative means. So I'm really proud of them for that. Arts in public places, there's a long process that you have to go through to try to get art in after you have a capital outlay project. And we had a committee that got together, they stuck it out. They had 285 entries, and the top 5 artists are going to be asked to come out and give a presentation on what they would, their proposal for our facility, and that's moving along actually faster than I thought it would. Great. We continue to work with the managed care organizations, still working on our IMD stuff with them to see if that's going to be approved or not. The way we're doing it is pretty much a test, trial and error, because we can't get an answer from them, so we're billing for the inpatient services. If they pay me, that's great, then evidently it was an approved service. So if not, then we know we have to go back to the drawing board. And we will be submitting pretty soon after the policy committee reviews the draft policy from our it's our tobacco-free committee. It started off as a smoke-free committee, but we're looking at going tobacco-free at the facility. We're one of 2 state psychiatric hospitals on the western side that still allow smoking or tobacco use on their premises, so we're kind of behind the times, but we're really moving forward on that, and our draft policy will be going to legal as soon as we're completed with it so they can review it. And I think that's a move in the right direction, being the Department of Health and allowing smoking on the grounds with staff and patients. One is it's kind of against the mission, but what we see with the number of incidents we have on the unit, the majority of incidents are around smoking and not having cigarettes, fighting other patients for cigarettes, getting in conflict with the staff because they don't have cigarettes. So it's across the board. I think that's going to actually help with that. And our average length of stay should go way down. People want to get back out. Administration is exempt from that. We did put that in the policy. I do not smoke. And I'll be open for questions.
Now maybe I'll have some later, closed session. Thank you. Thanks, great report. Appreciate it. Does anybody else have any questions for Troy?
Troy, how many nursing positions do you have open right now?
I believe I'm sitting on like 30 or 31. In fact, I can tell you. It's definitely it's close to that number.
And it's true at all the facilities. Our census is adjusted because of that. We can only have many patients there as we have staff. RN statewide, as we've said many, many times here, the private sector is hard to recruit, and the public sector is harder. So it's also impacting our fiscal year 15 budget. We've made that appropriate line change. Leonard's done that to beef up contracts dramatically in fiscal year 15, to accommodate the fact that we have to use a lot of agency nurses.
Is that one of the governor's targeted?
Yes.
Nursing, yes.
Nursing is, yes. So we're very appreciative of that, her executive recommendation. But it's a challenge, even if you're in a private hospital, it's a challenge to get nurses. So, yeah, that's your biggest challenge right now.
That and psych techs. I'll get you the exact number, Secretary. I thought I had it in this folder, but I don't see it.
All right, thank you, Troy. And Charles, I know we'll talk some more about your issues later too, but I appreciate you giving your report now.
Okay. So good morning. As the report reflects for our previous census for our quarter in October, our census was 13. In November, it was 15, and December is 19. Currently in December, as of today, it's also 19. Our goal for full capacity, we're looking at mid-January or mid-June for 36. In terms of our personnel and successful hiring, in the last 4 months, as the new administrator, I've noticed that our morale actually has increased in terms of our staff actually feeling like they actually do have a voice, as opposed to some of the feelings they may have had prior to the last 4 or 5 months. We continue to actively recruit for our various positions. The most exciting piece about this is that as of on the 18th, we start our new hire. Actually, the new hire orientation actually started on the 18th. What I'm excited about is that in that group we have an art therapist. To understand that we have not had for at least the last 18 months.
Wow.
And she's really excited about, being a part of our team. She's already come down and looked at the space that she'll be occupying. She already has ideas about it. She's really excited about actually getting there and actually having to work with the kids and to be able to have another option for them.
Yeah.
And infuse that into all of the treatments.
Put their energy into that.
Yes. And we will make sure that she can cover some of our weekend opportunities to engage with our kids.
Great.
In terms of the projects, we just actually completed what's referred to as phase 1. And phase 1 was just the upgrade to all of our camera systems. Prior to our upgrade, just to give you an idea, we may have had 40 cameras, but they were only in certain spots. As of the December 17th, we upgraded those cameras. At this point, we have almost, I think maybe 152, both interior and exterior cameras. We do have cameras now on the lodges, but obviously not in any of the bathrooms or any of the clients or students' rooms. And now we have the ability to, if there's any questions about anything, we have the ability to actually reflect and look to see exactly what happened. We've shared with our kids as part of our mission statement that when they ask us why they're there, we share with them that they're simply there to promote a safe and healthy healing environment. And to date, they've actually accepted that. We have not had any of them attempt to destroy them. We're just kind of part of why they're there, which is actually a good thing. So they're accepting actually why they're there. I think they feel a lot safer having them there. And another thing is that our front lobby, for those of you who have been there, wasn't necessarily, I guess, welcoming because of the type of furniture that we had. And due to the kindness of Dr. Mirren, he donated some furniture and whatnot. And so we were able to switch out some of the less friendly, unwelcoming furniture to make it look more appealing to visitors.
That's very nice of
him. For them to see that. What I would like to refer to as our alternative housing unit that was actually housed between lodges C and D, which was then what was referred to as a safety management unit. We have converted that into what I refer to now as the calming zone, or Lodge Z. And the purpose for that is that if we have a kid that really feels that the stimulus on that lodge, their assigned lodge is too much, they can request just some time alone, away from all of the other chaos that they may be involved in or that may be on the lodge. Also, we can use that, or they know that they can use that area to exercise some of their calming skills that they have been taught through all of the therapists and interactions with all of the other milieu staff that they have, and they've been really acceptable to that. In fact, they need it. Actually set the zone, but they realize that it has some different meanings, so we wanted to make sure that the purpose that they go there is to calm themselves, so hence the calming zone.
That's nice.
And so...
We'll have to get one of those at Santa Fe.
And we've actually used it. In fact, what we have to be mindful of, when I tell the staff to be mindful of, this is temporary. We don't want them to go there and stay because it's so common. It's just tiny. But we do have some that like it and don't want to return, so we have to, keep reminding them, okay, so how we doing, how we feeling, and we eventually transition them back to the original lodges. At this point, on an ongoing basis, we are repainting our facility again to make it just more appealing to those who are visual and to our kids, because it's their home, and we make sure that I may like pink, but the kids may not.
Different colors, I know that was that real drab colors we had there.
No, they're more bright, and it's kind of like looking at the health toner with really colors that pop, but we actually get their input.
It really was drab, wasn't it?
Yes. And so we're almost done with that, and depending on who it is, we'll ask them, what colors they prefer. We're also looking at working toward having our kids have their individual rooms personalized, so that if there's some things that they may or can bring from home, that one of our, I think it's the cultural team, community team look at and say that all these things are appropriate, then they can have them in their rooms to individualize, to make them less drab. So we're working toward that. In terms of miscellaneous items, we continue to work toward moving away from the points and level system. We are looking at implementing a Ready, Stop, Go system as a transitional phase to allow our kids and our staff to move away from what has been deemed more punitive and correctional in nature to a concept that's more therapeutic and clinical. But as you know, anytime you try to change or transition your program, there's always a lot of resistance. And when we hear this from our staff, we ask for feedback. We ask them to have an active voice in what we do. And because of that, we were originally going to do it in January. We heard what they had to say, and we pulled back because we want them to be fully invested in what we're trying to do. And any and everything we're trying to do is to benefit the kids that we're there to serve. And so that's what we're working toward. We also continue at any given time, for sure, at all of our all-staff meetings, which in most cases I facilitate, I make sure that either myself or the staff that's facilitating that continue to provide our staff, the direct care staff, who actually that's where the rubber meets the road, that they have all of the training and education they need in reference to trauma-informed care. And for those of you who may have heard the term and not really familiar with it, when I do all of our interviews, whether it's therapists or frontline staff, I try to break it down for them so they understand it, because once they hear it, I've been doing it all my life. And what we talk about is that what trauma-informed care is knowing as much information as possible about the traumas that the individuals that we serve have been through. Not only do the therapists need to know what that looks like, the janitor needs to know what that looks like, the housekeeper, the guy that's painting, everybody needs to know. They don't have to know the specifics, but just enough to know that if Bill comes up to me and looks at me funky or picks up something, that's not about me. It's about something that I may have done that may have been a trigger for him. And how do we get all this information? We talk to the aunt, the brother, the sister, the garbage man if he knows anything about him, and those individuals consider collateral. We take all that information and we sift through it to find out exactly why Bill's acting the way he is exhibiting or acting. And that way when we see the behavior, we know why. These are some of the reasons why. And what we do, and when we talk about trauma-informed care, we want to make sure that if Dr. Dorman is the therapist, that he has all of this information, that everything that he does, from making the treatment plan, to having the therapy sessions, to having the text deal with this guy, that they have all that information. They know exactly who they're getting, what to expect, what he likes, what he doesn't like, what makes them mad, what calms them down. That's what we talk about when we talk about trauma-informed care. And last thing I'll say is that the other concept that we're working toward, and that's part of the points and level system, is the Building Bridges Initiative framework. And that framework, when I talk about it to our staff, in my opinion, is not new. Because what it talks about is making sure everyone who's ever touched this kid is involved in every decision that's made about him. Whether it's going on a field trip, whether it is going for a family visit, whether it's going to the dentist, when they're going to be discharged, and that includes the kid himself. If you do a treatment plan, everybody's involved in that. And so the Building Bridges Initiative, basically, the premise about that is making sure everybody's on the same page, from start to finish. To make sure everybody has that trauma-informed care piece, and they understand it, and they're able to practice it through their actions.
That's great, Charles. And you've done a great job there. I mean, it's been challenging, and you've done a tremendous job there. You know, we should have a meeting. I know we had a governing board meeting at Sequoia, a summer or two ago. I can't remember exactly when it was. But we should have a governing board there either in April or July. We probably should consider talking about that. But come visit Sequoia. It would be great. That would be a great place for us as a governing board to take a look at all those changes that we've made there. And I would give Charles did a great job at our last facilities meeting. Charles did the speed of trust. You know, he did a great job with that. Also, Jeremy's been reading the book 16 times. He's going to do it tomorrow. And so that was very good also. So I appreciate all your hard work there. So open up for questions for you, see if anyone has any questions. Okay.
How many openings do you have right now?
I know we have 4 in nursing, and we have 4 in clinic.
One thing that's unique there from the other facilities, there's a lot of unique things, but if I'm correct with the background checks and everything, instead of going through DHI, like the other facilities, you have to go through CYFD.
Yes, sir.
So that's slowed down the process a little bit, depending on how fast or not fast they are with doing that. Okay. All right, George, how do you give a report? I know Michael's out with dental surgery. That's not pleasant. And appreciate you putting all this together. You did all the logistics and put everything together for us for today and tomorrow. And greatly appreciate that. And you want to tell us a little bit about Turquoise?
Sure. So starting with the census, in our adult detox rehab unit for the second quarter, we had a daily census of average of 31.8 patients out of 34 beds, which gives us 19.5% occupancy rate in our adult units.
Maybe, George, you want to mention too, I know since the last time we were here now, you've moved all the adults upstairs.
Yes, sir.
So you can have the adolescent unit upstairs.
So it's segregated between the adults and the adolescents. In the second quarter, we had a total of 141 admissions and 149 discharges of the adult unit. In the adolescent detox rehab unit, we had in the second quarter, we had 9.7 or 47.8% occupancy rate with an average census of 9.7. Our 41 admissions and 38 discharges during that time period. Year to date, down there, we've averaged about 8.8% adolescents and a 43.4% occupancy rate. We're still trying to build up the program and slowly move to a 4 census and not try to overcrowd it immediately. Staff, we're still building programs and seeing what works and what doesn't, and making changes to the right direction of what works. And on Motu, we saw a total of 846 patients in the second quarter. Today we see 1,774 patients, which is an incredible amount of people in our outpatient program. The big project that we've been working on is the second quarter is we worked real closely with Gail and Louie and some of Gail's other staff on a pre-survey for Joint Commission, which has been pretty interesting, challenging, starting it from the ground up with Joint Commission. Big eye opener. We're currently working on some plans, work plans to put in place for people in their respective areas to start working on getting the facility ready, getting the programs ready, necessary documentation, and all the work plans needed for Joint Commission. So that's going to be our next step in moving forward with Joint Commission. We're hoping to put in our application in June. That's our target date, with a hopefully becoming fully accredited by December of 2014. So that has been a major part of our second quarter project, is just preparing for that. A lot of work has been done. Staff has been really great, and well received the task of getting that up and going. Personnel, we have filled a total of 6 positions, 4 site techs, a behavioral health therapist, and a behavioral health therapist supervisor. We have 9 positions posted currently, and we have 6 more that are not posted, that are in various stages of being either reclassed or in the process of getting posted. One of them that we're posting, starting today, is a second position.
Right, I'm glad we talked about that this morning. I think that's really essential here, to have a second position with Suboxone abilities.
Right.
So that's great. Mario did a great job in HR there with all that.
Yes. And along with the Joint Commission, I do have to give credit to the county, because they've helped out tremendously with helping us with plans, documentation, and anything that we've asked from them. They've been really.
This campus is really closely intertwined between the 2 entities, so that relationship is essential, to being successful on this campus.
They own the systems, but we have to make sure we have the documentation for it. So that's where that relationship comes into play with it.
Right. Okay, and then does the moat in the winter time, does that tend to be busier, you think, or?
It's pretty consistent throughout the year. During the holidays, we see a little bit of a drop off. I think it's more that during the holidays, families feel more, I guess they want to look for their family that are out on the streets and bring them back inside. And I don't know, there's just something about the holidays that they're just, we see a little downturn in the census there. Looks like in the summer, you do see a little bit income. It's warmer outside, you have more people out there. They're not so much into, I guess, any shelters in place where they're being taken care of, and not needing to be outside on the streets looking for their habits or their.
Right.
Is the MO2 a 7-day-a-week operation?
Yes, and it's open from 8 to 8 every day.
Thank you. Any questions I'd like to ask? Thank you very much. Report, John.
Through Los Lunas, thank you, Brett. Through Los Lunas Community Program, our present unduplicated census stands at 75 at present time. We continue to work closely with the Department of Corrections officials related to the Los Lunas Training Center campus, and their intention, I think part of this will depend on what comes out of the legislative session this time around, but they have looked at quite a bit of expansion of corrections activity onto that campus. That would, at present time, include the men's recovery program going from 50 to 150 housed there. We're also looking at up to, I believe, approximately 4 cottages as halfway situations for prisoners.
Does that all look like it's going to happen?
Their intention is to, and we've been working also with Mike Brown's office on this, their intention is to proceed, but I think course, funding those issues related on the session coming out. The one plus, at least from my perspective, if corrections becomes that heavily involved with that campus, they would, the intention would be to have them identified as the lead tenant, which would lighten our load in terms of maintenance activity and outlay related to the campus. So we'll just have to see how that kind of plays out. That's
We'll
where
talk
it's
to
at.
Michael about that. I have to get maybe Michael Brown to give us up here a briefing on that. That's very interesting.
We'll see if he has more info than I do, but that's what I presently understand.
It's favorable to them.
Yes, it would be, correct. We are, our maintenance crews are presently doing quite a bit of reflooring work and door window replacements in quite a few of our leased residential facilities. So that activity continues. Related to the campus itself, though.
John, if they are leased, isn't it the landlord's responsibility to do that?
The agreements that we've had, the issues are that we may go into a leased home that requires some modification initially to be able to house our the grouping of consumers that we're looking at. But then in terms of replacements, the flooring issues, doors and windows, those basically fall on us due to, it could be just a need to replace due to accidents, spillage, use of the carpets by the consumers. It could be anything from valve accidents to a lot of different issues that we run into on the flooring, so it is up to us to do the replacements. Windows and doors are usually breakages occurring due to some of our consumer activity, so it's more that type of replacement. Right. Is that answer?
I think it's wonderful.
No reason we could not look back at that, but those type of agreements definitely landlords involved, sometimes that's required. Over on the campus again, we're going through a lot of lighting, landscaping, sewer line issues there on the main campus, just with that old infrastructure and the amount of heavy usage that we have going on there. So we continue to work with that, along with corrections on that. We have re-roofing and jobs going on the campus also, which has taken quite a bit of time. Sorry, the Secretary of State's office has been in contact with us related to the campus also, looking for 10,000 square feet of storage area for voting machines. At first they were looking at climate control, and our answer to that was good luck. Then when we backed off of that, then we were down to the square footage issue, continuous 10,000 square foot. Fairly difficult. We're in the process of attempting to identify some split up square footage that may or may not meet their needs. But that's been the request, and that was basically, I would say, we initiated that about 60 days ago or so. We've been looking at there. On the consumer and our programming side, we have implemented the electronic spreadsheet on abuse, neglect, exploitation. So that, and we're implementing that this month so that we have a better tracking mechanism both for initial incidents, outcomes, and recommendations on how we need to proceed on those. So that I think will be helpful for us. Also in this month we have finalized our performance improvement plan for 14-15 for LLCP. That will involve a couple of the items just to identify as management, of course the overtime issue, and of course the accreditation proceeding with it. The related to CARF accreditation, Kathy had sent over to us one sample contract that we were looking at as possible use for our consultants. We've also obtained 2 other sample contracts from the consultant side of things, so we're kind of doing a mix and match and see what reads the best for us for submission on that.
I'm surprised. Well, it's hard to find CARF consultants, I'm guessing. They're not a lot of those out there, are there?
No, not so much. Usually on the administrative end, consulting in. They're easier to come by than the programmatic folks. We did use Carve main office out of Tucson to identify a couple people to us. We have made a connection with a gentleman by the name of Fred Dominguez out of California, who would be potentially our lead surveyor. The programmatic surveyor, I cannot recall the lady's mind at present time, but it's that type of survey that we're looking at there, Brad.
Good, that's very good, John.
On our personnel side, we continue to work with the whole issue of the dental clinic that Lynn's actively involved with. Also, I just got word this morning that we do have at least one of the hygienist positions there that has hit the personnel ability to hire there. We think we have an interest level of 1 or 2 people at the present time there. We are operating with the dental clinic itself. Our dentist is out with some related medical issues, but also annual leave issues until the 23rd, I think, was when I see ready again. So we'll continue to work there.
Appreciate that, too, John. That's a very, as Lynn leading now, that's a very complicated topic. Even yesterday at the hearing, the one representative, was talking accurately about how difficult it is to get dentists that anywhere in the state that want to do this type of work, or Medicaid even work, right? Correct. They lose money, but I know we're trying to think of everything out of the box here to solve this problem.
I'm hopeful Dr. Lyons will continue with us. Hopefully that doesn't become an issue, but I think we'll know a bit more on that by the end of the month with where we sit there.
John, are your open positions, what is driving your significant overtime?
Yes. They're coming in really in 3 areas: direct care, our certified medication aides, and also in our maintenance department.
And probably some calls too, right?
There is some on call, yes, related to that, but when you really look at it, the bulk is breaking into those 3 areas.
I think that's affecting your financial status.
Definitely. And we've got, with the acuity levels of the consumers that we have, the staffing patterns that have been identified with the 25 or so residents, makes it, pushes us into overtime issues very quickly to make sure that those are covered 24/7. And the heaviness of the staffing to consumer load, when we're dealing with maybe 2 staff per consumer on a 16-hour basis, then we might drop to 1-on-1 on an 8-hour basis. So that's where definitely it's impacted.
If you bury the papers about the meetings, these budgetary meetings that have been going on, that's an issue. I think Lucky Burrell brought up at the DFA meeting that why is there so much? It's statewide. They didn't mention you by name.
Yeah.
It's statewide.
I figure it's coming, but
Yeah, so we ought not to be there.
but it is. It's that. It's not like coverage for office positions or anything like that. Certified medication aides, but care of the other. Actually, on the flip side, though, as we talk about the nursing situations for other facilities, Las Lunas is really in good shape at present time with all. I think there may be 1 open nursing position, but I think we have 12 or 13 on staff, and we're down to, I think we have 1 8-hour shift per week that requires a contract.
And that's that Ida should deal in, I think, right?
Yes.
Yeah, they're doing a good job.
Still there. We are going through now the Metro Regions Jackson Community Practice, the annual review. Consumers have been identified. We expect them to tail into this month or early part of February for that review. Medicaid billing audit for those years 2007 and 10, that's been addressed. And
Right, and Gabrielle's in the final stages of that with the signature from the AG, and then we're going to transfer the money transfer the money over there, so.
But we're also believing the issues that brought that about have been resolved.
Yes.
Documentation.
yes, and as they come in for reviews from licensing out of Division of Health Improvement. We're in for their annual audit on our intermediate care facility, the 4-bed facility. We're presently awaiting the final report. I believe there were basically 2 items identified. One was on the involvement of our contracted pharmacy firm on their review of psychotropic medications to identify if they're feeling that those should be any changes or if they're recommending decreases of that part of it. The other was on some consistency on some progress notes, but we don't have the exact reading on that. But overall, a good review there. 2 items identified. And just attended some staff and myself attended some EDSD annual conferences. And we also are involved with the Division of Health Improvement on their 24-hour abuse, neglect, exploitation reporting system. I sit on that grouping as they work to develop that. So that, Brad, present time is my report, unless there's questions for me.
John, again, we'll probably, I'll bet sometime 2014, we'll probably be having more meeting here.
That's fine.
As well, you know, go back there again. It's always great for us to go see them.
And actually, our staff enjoys having the people out.
Right.
So they'll match names to
Helps
faces.
them a lot too.
Do that. Thank you.
Any questions for John? And Lori, I know you've got some challenges too right now.
Sure. Always somehow. As you can see from the report, the census for the last quarter fluctuated right around 122. After the holidays, we did see an increase in some of the admissions. We've been hovering right around 125 since January 1st. As far as the construction projects are going at the facility, we're not doing any new construction projects in-house right now, but we are continuing to do the remodeling, some slight remodeling in the resident rooms going around the facility, doing some painting, some wall protection, installing some new countertops and things like that we're using from the operating budget to do right now.
I know your next topic, Secretary Hell's going to be very concerned about as well as you are, and we all are.
Absolutely, yeah. Yeah, we were very disappointed to receive the priority list from the VA. I've just forwarded the letter over to Secretary Hale that we sent to General Shinseki. That went out yesterday to all of the legislative representatives. We were placed number 60 on the Priority 1 VA list, which unfortunately they are funding to Project 18 this year. But if you look at the whole priority list, it's almost $400 million in projects, including all the renovations, the safety projects, and the new construction. So, you know, everybody keeps asking me when we're going to get the money from the VA, and I just honestly cannot give a good answer. I sent the letter off to everyone to be involved, stating that we don't feel like that we were placed appropriately on that priority list based on some of the placement of other projects in front of us. We'll see what happens. You know, Senator Udall is very involved with this. He was there for Veterans Day, and we talked about the project, and he made some calls when he went back to Washington. So his staff down in Las Cruces continues to call me usually once a month or so to find out where we're at and what they can help with. So we're hoping that maybe we'll get a little bit more a push back to the VA to see if there's anything that can be done. I'm just very, very worried that state money is not going to last sitting there. That's $8 million. It's been sitting there since 2008, and I'm just worried that it's not going to.
Secretary Hall,
You know what? It's not the only issue we have with the federal VA side. So what we have been planning, and we're starting next month, is to bring in all the regional staffers for the legislative committees, and we're going to give them a round the world of, hey, these are the priorities we see in the veteran community in Mexico. This being one of them. Again, we've had many since 2008. We're going in for the cemetery program this legislative session. You know, they're going to face the same type of prioritization obstacles with the VA. So we're going to start with the staffers next month, and then try and get together with the actual legislators very quickly consider you all being the key, since he is on the Veterans Committee on the Senate side. So, we have issues with DC right now in the veteran world.
Right. And I know Lori's trying to put a positive face on it today, but I know you're devastated by that. I mean,
Absolutely.
Put so much work into this the
Yeah.
last several years, and it's such a wonderful project.
It is, it is. I mean, we basically dropped 20 notches in 4 fiscal years. I mean, 4 fiscal years ago, we were number 48. And we consistently go down each year. And, you know, we were so close when the government shut down in October, that the letter was actually done for the funding and sitting on the general's desk. And then the government shut down and no letters got signed. And so with no letters being signed and the fiscal year coming and going, no other projects got funded. So it's very frustrating.
Our biggest concern now is with that delay, the state side, the monies are
Is at risk.
at risk.
And that's what I put in the letter, and we'll see. I mean, there's the National Association is having a conference in February, and you know, we can see if there's an opportunity to talk to people up in DC, maybe General Shinseki at that time or something. So maybe we can see about that. So.
And I'm going back to DC almost every month right now. So if we have an opportunity, I'll probably need to make an opportunity to
That's perfect.
really push that.
Okay.
That's what we need to do.
Yeah, any help is appreciated. So.
Thank you.
In the hiring world, you know, we continue to hire consistently at the facility. We started, as I reported last quarter, we started a hiring committee, which is being used to streamline the process in-house. So we have a committee that is very, very good at doing the reference checks and getting all the paperwork signed, and so we're speeding that through the facility. So it's been a very good process. I do still have several positions that are open. You know, we have 3 LPN positions, I have 5 RN positions, and a handful of CNA positions. In the reclasses, we got the CMAs back in, so I have 9 positions now that we're actively recruiting for that, which takes a great burden off of the nurses, so they're really good right-hand people for the nurses. So we're very anxious to get that class started. I have a couple people that are on the list that are already certified, so they can go right into the floor, but the other ones, we do the class, we have the certification to do the class in-house. So we'll do the CMA training there, so we're really looking forward to that. You know, during the last quarter, of course, were the holidays, and the Veterans Home is always blessed to have so many veterans groups come and support us. The residents received, literally, I can tell you that the residents put together a wish list of things that they want for Christmas. It's like getting your Santa's list from your kids, and they put down things, anything that they want, and the veterans groups literally buy every single thing on every single list every year. It is just a wonderful, wonderful group. The local Walmart supported pajamas with jammies for vets, and so the local community got to go down and purchase things for the veterans' homes there. We had groups that purchased things for them to go shopping, so we had gift cards. So it's very, very heartwarming to see that during the years. We also completed all our strategic planning processes, and we did a survey of all the staff through SurveyMonkey regarding each one of the different objectives and strategies in the strategic plan. And I gathered all that information before the holidays, and we trended all that information, and I gave it out to the strategic planning leaders in the facility, and they've been working on their plans, and you can see through each one of the objectives what we're trying to accomplish. And so we're taking information back from the hands-on staff. We did that as our general staff meeting in December. That's all we did was complete that strategic planning process guide. And so we, crunched all those numbers and did some baseline information. So our groups are working on each one of these areas. And we're really looking forward to a lot of these projects coming to fruition over the next couple months as we get going.
That's great.
So I would stand for any questions if anybody has any at this point.
You're doing great, and when we need warmer weather, we'll work our way down to your facility.
Perfect. Anytime.
Beautiful campus.
Yep.
They always said when they see it. Secretary Howell, we greatly appreciate you and your part. I know it's pretty hard to go from 60 to 2.
I'd have to be 16 or 17 on the list.
Yeah.
So, well.
But Senator Udall is pretty
Very influential.
very influential.
Yeah, he's on the House Appropriations, Veterans House Appropriations.
So that's probably our best asset.
Absolutely, at this point, yes. Yes, sir.
Thanks very, very
Thank
much.
you.
And I know Janie and Roswell, it's kind of a good time right now with the shootings. And I know that my kids go there, that school. So, it's been a difficult time now. They went back this morning.
Yes,
My son didn't want to go to school this morning, but he kind of went into school.
I don't blame him.
But it's been a difficult time in Roswell. But I know with the demolition of the old building, that's been highlighted quite a bit, right?
Right, they've torn down most of it. The only part that's still standing is the three-story structured part, but I think they're expecting to be there through probably the end of March, leveling it and all of that, but they're doing a lot of hauling away now. It's still being broke into pretty much every day. Kids around the neighborhood are interested in what's going on in there, and so I spend lots of time with the city police.
Well, that's been a burden for years, so maybe it'll stop being a burden pretty soon.
I hope so.
It's state land, so I guess they can decide if they want to build something like that.
Right. And I think there's a lot of interest in the land. So,
Okay, great.
I'll start with our statistical data. On our medical rehab unit for the quarter, we had 27 admissions and 29 discharges with an average daily census of 4. The length of stay was 12.7. On CDU, our admissions were 70, discharges 78, with a daily census of 15.4 and a length of stay of 18.9. We're not running much in outpatients on physical therapy or speech, but we've increased our outpatient visits on the physical therapy to 91 for the quarter. Currently today, our census is 7 on medical rehab. With the holiday census tends to decrease on both units. And of course, a lot of people on the chemical dependency unit, they use New Year's resolution to increase census there. So by the end of the month, we ought to be back up to our 16 on our chemical dependency unit. For hires, we did 4 hires for the quarter, 3 nurse techs and 1 biller. And like I said, on our medical rehab unit, our goal is to average 10 patients there. Today we'll have 7, which is good compared to what it has been being. And on chemical dependency, we're holding census at 16 because we're low with counselors. We'll have 2 counselors, and they can average about 8 per counselor.
Great, Janie. And then after me, I just need to ask you something I'll forget, but before you leave today, I just need to catch up with you for a second. I'll forget that. But, thank you very much. Thanks for driving all the way up from Roswell. And Jeremy, I know, we were getting a lot of questions about the old campus, and that's not, that's GFD, but we were with Representative Varela last week. We asked lots of questions. I think I mentioned to you about the old campus and the cemetery and the water issues and a lot of things, these veterans. I don't know if you could make some comments on that today as well.
Sure. And good morning, guys. And want to talk to you guys a little bit about right at the end of this report. And I'll try to get through this as quickly as possible. I seem to have the longest report of everybody. So. All right. To start out about the old campus, we did talk with Mike Brown and ongoing contact with Brad Isaacson and GSD about the old campus. GSD has issued an EOI, expression of interest, about the old campus, and there's roughly a lot of the historical value there. So they're currently evaluating the different proposals that have come in to see if there's anything viable there. They want to do their best that hopefully anybody that would be interested would want to maintain its historical integrity just to the best degree as possible. There's a number of projects over there that they're looking at in regards to getting certain upgrades and making sure that We're in certain regulatory compliance around the needs of the old facilities, even though they're abandoned, but certain things we need to maintain there. So, and I'll be glad to stand for any questions if there's anything specific that anybody wants to know.
The cemetery, what's the latest on the cemetery?
They've decided to go to the xeriscape, so it should minimize the water issues there. There is still some discretion on how much water acre feet that they would be allotted to cover that cemetery. I think that we've cleared up some of the issues that have gone around with their expansion. I know that the cemetery, the veteran cemetery there, is interested in expanding that property there. They currently have, I believe, 14 or so acres, and there is a proposal to potentially expand that to 100 or so, but they believe that what they have right now will take them to 2020 at some point or there beyond for their spaces, and they primarily would like another 20 acres that would take them well into the mid part of the century. So right now, I know there was a big concern around the water consumption there, but they're working out some possible options in regards to water from the local community versus the spring water from the Fort Baird, and then what they can do to minimize the usage of water for that particular cemetery there. But we've had a number of people come down from the VA cemetery group and also met with the local representatives up here around that. So right now, doesn't seem to be too many logistical challenges. They have moved forward with the completion of that project, but they did get pushed back due to the government shutdown. So that extended, probably to the mid part of this year is where they're planning to complete their upgrades of that cemetery. But it's starting to look pretty nice over there.
Do you have any questions on that, Secretary?
No, the only thing I would add is my teleconference is on that subject. They've asked for another 100 acres, but out of that 100 acres, they actually get only 20 acres of usable, variable land just because of the rock formation, et cetera. So sounds like a large land grab, but in essence, they're acquiring enough land that will take them out about 60 years in all that projected data. So it should give it a good long life. Most people were raising questions about why 100 acres. There's not that many veterans down in the Southwest,
Right.
and it's really because it's how much of that land they can actually use to bury. So,
Right.
Some tough earth over there.
right, which is part of the issue with the water when they talk about trying to bring in gray water from downtown. Any lines they put in have to go through granite, so that's not really an option right now.
Wow, that'd be
Hugely expensive.
water. The VA doesn't want to topic down there. Water.
It's a liquid gold for there. But it is looking nice in what they're doing there, giving a number of options to the veterans.
Jeremy, why don't you try to hit the high points here, just on your annual report, and so you don't have to read every piece of it, but hit the high points.
Sure. Just starting with census, we did average 134 residents. Actually, a little over that for the entire quarter. We are actually at 134 as we speak.
Very good.
So we have, like Janie, and I'm sure probably the other facilities experience right around the holidays, a lot of people are preferring to stay home and celebrate and do the best they can to spend with family. And now we're starting to see an influx come back up. Same thing with Yucca Lodge, and reporting our operational capacity, we've averaged around 90% of our staff beds, and over that period of time as well. For the projects in construction, there's a number of things that we're working on. We also have embarked on our strategic planning process. We are looking to get new beds, that's already in process right now for the facility as well. That's much needed because we have some very old beds there. One of the things that's around our compliance is getting hand washing stations and direct patient care areas, primarily in the gyms. So we are working with Mike Brown and GSD to get that underway, as well as Grant County. We also would like to upgrade our camera surveillance system. That is something that we've also talked about with property control and GSD. One of the main things that is very time sensitive for us. It's paramount that we have a MDS system, Galaxy system that we utilize. I understand we'll be transitioning into the company that bought them, Point Click Care, and they also have some options around electronic health records that are bundled in with that. So we might have really hit two birds with one stone with this particular company.
We'll talk more about that one tomorrow. That's an interesting one.
Sure. And we are looking to do some further management leadership training. We've been talking with Tula and Melissa about doing some leadership training with EDI. Our HR personnel, we've actually had 21 hires in the last quarter, and we just got our reclasses finally got pushed through. That's primarily going to help bolster our nursing force, so we were hoping to increase our census actually beyond where we are. So once those finally kind of start kicking in, but we're trying to heavily recruit at this point, and so that's been a little bit of a challenge.
Another big topic tomorrow, we're just going over, Teresa will be there tomorrow, so we'll talk a lot tomorrow about all our facilities and their vacancies and reclasses.
Good. So we've done well with our CNA class. We have relied on some contract staff, and we've actually graduated 2 CNA classes since last quarter, or the second one's about to graduate, and we're going to be running the third one in February. A number of our, we do run a job fair as well, that we had roughly 30 job seekers attend. With the events in our community, we have been doing a number of different things to stay involved, and there's the host list, especially around health festivals and different committees. We tend to stay very heavily involved with that, and we're focusing on kind of a hospitality committee to hopefully make the transition from home into our facility as pleasant as possible. Our wait list has increased some, but one of the things we're primarily focused on is bringing people from home. Recently, and this is actually around our veterans unit, we've had several people come in, and we send out our teams to evaluate them in their home and the way they're living. They were literally in a situation that the home should have been condemned, and actually APS was involved in this, but we're trying to get more communication line with the community on those that are strictly in a very dire situation. We would like to see if we can primarily help them first. Our philosophy is if someone's already been taken care of in another facility, then we're looking at a hierarchy of need. So right now that was something that we've been really doing a reach out campaign around. We'll talk a little bit more, I guess, tomorrow around the Pyxis and medication systems in our pharmacy.
Yeah, that's a big topic tomorrow.
And again, around our MDS, we're requiring at our facility that all our MDS coordinators become certified. So they're actually in the midst of getting their training as of right now. We had, with some of our new hires, our actually employee influenza rate for vaccination rate has actually decreased just a few percentage points, but we're working on getting that back up because we were 95 at the last governing board. The resident influenza vaccination rate has actually increased from all the way up to 99%.
Is that true everywhere? Are we doing
Not that good.
pretty good on the patient side? Or?
The resident side is good. We're in the process of doing our boosters right now. So we do a booster shot.
I know it's tougher with employees.
Yeah, it is. So
If you're a nurse, they don't want to get a flu shot.
I
Right?
know.
What is the resistance? What is the reason that people give for, employees give for not wanting the flu shot?
It is still, they think they're going to get the flu from the flu
I
shot.
guess
It does
last
not
time you
matter
did.
what information you give them. There's some people just feel that,
Or they say, you're great.
oh, they're going to get something from it.
It's the same acute care hospitals.
Yeah. And they're nurses, yeah, they're nurses.
At least with our patients, that's great.
The residents are fine, yeah.
That's excellent.
We still try to push that they're up, make sure they're not bringing anything with them to infect the residents. But so far, so good. We've made some headway with educating them about the vaccination, our staff. We are looking to replace the x-ray machine. That's something else we've talked about. That actually should have been part of our projects as well. We were talking with Mike Brown about that. The dental services, there was some number of logistical challenges around getting dental services there, around reimbursement rates by Medicaid, but we've actually engaged in, this was kind of a byproduct of engaging with Hidalgo Medical Services in the community. They're actually, I believe we've talked to AGC about doing an affiliation agreement of sorts, that they're trying to bolster the medical residents doing rural health care, and we've actually tried to jump on the front edge of that and volunteer to be part of that rotation. So HMS is asked to do a collaborative effort where they do part of their residency in our facility, and that will be monitored and overseen, and we're working out the logistics of that right now. But as a byproduct of that, they also talked about possibly offering the dental services for the facility as well. So those are a number of things that we'll talk about as well. Operationally, we're doing okay. The second quarter had, there was one of the main points here was that we're transitioning to a new clearinghouse, as a number of the other facilities are doing. Yucca Lodge, this one.
That'll be a good topic for tomorrow too. You want to talk about that tomorrow?
The Yucca Lodge?
Yeah, not a clearinghouse topic, we'll talk about that tomorrow.
You want to move to SSI?
Sure. The SSI group.
Yeah, we'll talk about that too. We'll talk about that tomorrow as well.
Okay. And Yucca Lodge, for the reporting on the second quarter, we had 32 clients. 5 were scheduled for admission, 11 were approved and pending available beds, and 16 are in the current approval and screening process. We're actually trying to re-bolster that program. We're also starting to clean up that unit. We've had some issues in the unit recently, so we're trying to get that all cleaned up and taken care of at this point. There's a number of operational things that we're getting into right at this point, and I mean, they are looking at some new billing systems there as well. So far we're doing okay, and at this point I stand for questions.